Te hei Māori ora, tēnā koutou, tēnā tātou katoa. Ki te ato me whakakororia I tono ingoa ngā wā katoa. Tēnā koutou I au tātou tēne mate, haere atu. Apiri hono, tātai hono, e te iwi, tēnā koutou, ki ngā mana whenua, e ngā waka, e ngā reo, e ngā mana. Nō reira, tēnā koutou, tēnā tātou katoa. Well, thank you for the introduction, and also notice I'm slotted between two clerks today. A thorn between two roses, I suspect, two wise elders, and what a privilege that is. And I think that reflects the significance of this day and the fact that the Right Honourable Helen Clark and young Tex are devoting their time to addressing this issue, speaks to the importance of it at this time for our country. I'm very pleased to be hosting this Addiction Leadership Day as your Minister of Health. A year ago, I was on a panel of politicians aspiring to be part of the next government. I was, in fact, the Associate Health Spokesperson. I've had to piece this together in my own mind, a role which I had for quite a long period of time. Unbeknownst to me at that stage, I was to become the health spokesperson rather than the economic development spokesperson in short order, and the Minister of Health. And I feel a real sense of privilege to have taken on this role. Also on that panel was Julianne Genter, who's now my Associate Minister of Health, and of course I have the Honourable Jenny Salisa as another Associate Minister of Health. I wanted to also acknowledge today other parliamentary colleagues that are here. I can spot Jamie Strange from the Labour Party, but I also wanted, and there may be others, forgive me if I miss any, but I wanted to acknowledge Matt Ducey. Matt, I wondered if you wanted to stand up, who has spoken on, questioned me in Parliament on mental health and addictions issues, and I think it's so important that we work in a cross-parliamentary way on these issues. If we are to move things forward, we need to be all moving forward together. So any difficult questions for Matt during the morning tea? From the sector, obviously I'd like to acknowledge Vanessa Caldwell and Ross Bell, who've been instrumental in bringing Helen Clark here today to give an international perspective to the meeting. And I want to acknowledge all of you. If I didn't know a year ago when I sat on that panel what a dedicated, passionate sector you were, I certainly did by the end of it. I travel around asking for free and frank advice, and this is one group I know I'll have no problem with. On that day I heard about funding, importance of workforce development, rights of people to access treatment for their substance use, gambling, mental health. All those issues were raised with me very clearly a year ago. And as the Minister of Health, I have been entrusted to enable the changes that the sector has already been seeking for some time. I am determined as Minister to build strong and productive relationships across the sector. It is, I think, part of my role, leadership role as Minister of Health, to do that relationship building. But it's also my expectation of DHBs, the District Health Boards and the Ministry of Health, that they play their part in building those relationships. And if we're honest, they haven't always been what they could be. And I am requesting that all parts of the sector work together to build those relationships, to strengthen them, to make the change that needs to be made. We need to address the impact of addiction. It's not always easy hearing people say that more must be done, but we need to acknowledge up front that more must be done. I'm heartened by the compassion and the passion that you put into your work every day as people at the coalface dealing with addictions on a daily basis. People have told me that they want to have things done differently, and I want to signal that I am willing to contribute to that effort. We often hear that mental health services or the addiction treatment sector, in quotes, are in crisis, and we already know that what the problems are and that we should just get on with it. While there are no easy answers to these problems within the sector. There's no one silver bullet. It's vital that we come together to address them. It will require our collective effort to confront the problems of addiction and its real complexities. And they include, of course, coexisting problems. Our services need to better connect to reflect that reality that many people with an addiction problem also have a mental health problem. New Zealanders expect our health system to work together to improve well-being, and therefore we need complementary services to ensure just that. The government has made it clear that it will work with Māori and Pacific, and I expect the same of our agencies. The principles of manaakitanga, kaitiakitanga and whanaungatanga should inform our decision-making, and it will be the responsibility of agencies to demonstrate how we do this. Having a stronger consumer voice is important to our working together. People who are living with issues of addiction need to be a part of the solutions that we come up with. And we also need to hear the voices of youth. When we do that, we gain a fuller understanding of the problems that exist and how we can tailor or strengthen our services to meet the diverse needs that are out there. My message across the sector has been clear: give me free and frank advice. Give me the advice you think I need to hear, not what you think I want to hear. And I may not always agree. I mean, that's the thing to say up front, but I do pledge that I will listen. We need to challenge each other. That's the only way that we will get to the best solutions across New Zealand. A high level of commitment is needed to identify the solutions to get to that change and to sustain the challenges and changes that we want to make. This government has taken a major step forward, in my view, in launching the inquiry into mental health and addictions. And I'd like to acknowledge today Professor Ron Patterson here, former Health and Disability Commissioner, who's graciously accepted a position convening the panel. And also I want to acknowledge Dr. Barbara Disley, who's filled plenty of leadership roles in the mental health system since the 1990s and has an in-depth understanding of mental health and addiction services. And I want to acknowledge also Dean Rangihuna, who is here as someone with experience accessing services and as a consumer advocate. Dean's contribution, in my view, is one of the most important. I know he feels the weight of that on his shoulders, but we are incredibly privileged to have him as a part of our panel, and it has been my very real privilege to get to know these panel members a little over the recent weeks. And I also want to acknowledge the other panel members, Jemima Tiatia Seith, Josiah Tuala Mali'i. Their contribution as well is incredibly important. Josiah is on the Pacific Youth Leadership and Transformation Trust and a director on the board of LEVAR. And as a young person, brings quite a different perspective also to that panel and some ideas about how we connect better. My experience is that reaching out to rangatahi to understand how we can better service their needs is one of the biggest challenges we have. As a politician in election year, I host, of course, town hall meetings where you can come and meet your local MP. And I like to think I'm quite accessible, so why would you come to one of those meetings when you could walk through my door? But I still, on a good day, might get 40 or 50 people there who'll turn up. And I can tell you that in that room, there will always be one person under the age of 40. There's always one. They will be, it's not me, by the way, either, sadly, anymore. They will be incredibly well informed. They'll be politically connected. They'll be a statistical anomaly. Everybody else in that room will be over 40. If you hold a panel and you ask people to come and present their views in a town hall style meeting, you won't get people under 40 in there. So we know the problem. Solving it is a bigger challenge, and I'd encourage all of you here today to think about how the community that you service and engage with is best encouraged to get views across to that panel, because that is one of their biggest challenges. I'm sure they will say something about that when they present during the day. The Prime Minister herself has gone on record as saying the She wants the inquiry to report back with a clear assessment of the current strengths and weaknesses of our community response to mental health and of the response of the broader mental health system, including addiction treatment. The Prime Minister herself launched this inquiry, which I think again indicates the importance that this government puts on having better mental health and addiction services. I believe we need to transform mental health and addiction services in terms of the vision that we have. We need to make sure that we are representing all people and serving all people. I also want to acknowledge, though, that doesn't detract from the work that's already being done, because the people, in my experience, who work in the sector get up every day and work with some of the most vulnerable people in our society. And so for those of you that do that every day, and those of you that do it from time to time, I really want to thank you for what you do. As I said earlier, transformation won't be the result of one big bang. I believe that it will be the aggregate of many smaller changes that we can bring together to realise the vision. We do need a sustained investment in developing the workforce, giving people the skills they need to innovate, and supporting frontline staff, DHB funders and planners, Ministry of Health, agencies such as the Health Promotion Agency and the Mental Health Commission and the Health Quality and Safety Commission. On the 14th of February, it was my real pleasure to announce that the government had agreed to negotiate an agreement to extend the care and support pay equity settlement to include mental health and addiction support workers. In my view, it's critical that frontline workers are paid fairly for the important work that you do, not before time, I might add. We need to be open to new forms of contracting, measuring outcomes, what we deliver the service users and their families. We're all well aware of the impact that addictions has across all social and justice issues. I know my Cabinet colleagues, who are represented here today as well, are in commitment to building and strengthening the mental health and addiction treatment sectors. The government said that it wants to invest in addiction treatment services. By how much and for what is still to be determined, and the inquiry will help to inform us of that. The inquiry was deliberately set up as independent because that is a mechanism which ensures that it will give us robust findings. Independent inquiries at times make ministers uncomfortable. I think that's a given. But I have the privilege of being part of a first-term government that doesn't have too much baggage and that can handle some challenging advice. So I've asked the inquiry to give me that. You, of course, have to be careful what you wish for. But if we don't lay out broadly what needs to happen, then you will get a partial solution. I certainly pushed back with officials who, kindly and probably wanting to protect my interests, sought to restrict the inquiry's terms of reference to primary and secondary services. In my view, we need to look at prevention. We need to look at the broader picture. And so I am very keen that we have that fuller picture, looking at the social determinants and so on, as a part of the story that comes out of the inquiry and challenges government, this government and potentially future governments, in terms of the path we need to be on to provide better support and care for those facing issues of addiction. I tend to vary from my speeches, so I have to find my place again. Officials are probably despairing at the back as I've gone off on another tangent. I really am at the point of closing remarks, though. I do want to acknowledge again what an honour it is to have Helen Clark here today. We are reminded by your presence of the really important contribution New Zealand has made to human rights issues, both in your time as Prime Minister and beyond, in your own contribution, and we are very proud of you. So we've got a challenge ahead of us to have New Zealand as a world leader in addiction treatment services. I know as leaders in the addiction treatment sector, you will make your contributions felt. As a sector, we need to be able to articulate what we see as the gaps and what is needed, because together we can work to deliver the range of services people and families in crisis need to aid them in their recovery. Thank you all for the services you provide. Thank you for listening, and my very best wishes for the rest of your day. Thank you very much.